everyone, and welcome to the Communicating with Confianza, a health literacy eco series. My name is Dr. Raquel Romero, and I'm going to be the facilitator for the eco session today. This session is brought to you by Health Confianza team in collaboration with the UT Health San Antonio Super Hub, the YMCA, the South Central EHEC, and the University of Texas at Austin. Please let me start by saying that Health Confianza is a community-wide health literacy program that aims to provide health literacy education, training, resources, workforce development for the Hart County and the surrounding areas. Confianza is the Spanish word for trust. Our team believes that health literacy is critical to transform health and to achieve health equity for all. With a goal to increase health literacy in our community, these sessions were carefully planned to equip with tools and skills to all of those to attend the sessions, and each session build upon each other. So we highly encourage attending each session for an enhanced and holistic learning experience. I invite you to explore what we are going to offer in our following sessions. And thank you very much for your support and your trust on us to be part of these sessions that bring us close together with a deep desire to have a better understanding of health literacy. For those that are new to the ECHO platform, ECHO stands for Extension for Community Health Outcomes, a virtual telementoring stage specifically designed to create connections between communities and subject matter experts. ECHO sessions have the following components. We start with the welcome, then we'll have introductions, announcements, and we have didactics, and then we have a case presentation and a group discussion. If you are interested in submitting a real-life story, please contact the Administration ECHO team for more information. And please remember that no personal health information, PHI, is allowed to share at any point in these sessions. And what is a PHI or personal health information? Was the OBs, dates of birth, addresses, appointment, etc. Now, before we move to the Confianza team, there are a few technical points that I need to mention. Please ensure you rename yourself in Zoom to reflect your first and last name. To help us with our attendance records, please enter your full name, your affiliation address, in the chat box. And please remember, stay muted only if you are speaking. We promote interaction in our sessions, and we would love to see everyone's faces. So if you are able and comfortable, I invite you and encourage you to join us by video, especially in the discussion part of the session. And if you have any connection problems or issues, please send a private message to the ECHO IT for assistance. Now let's move to the introductions, and I would like to start with Dr. Melanie Stone, who is also our didactics presenter for today.
Thank you, Raquel. Hi, everyone. It's good to see you. So I'm Melanie Stone. I am an assistant professor here at UT San Antonio in our Department of Family and Community Medicine and our School of Public Health. And I direct our Community Engaged Learning Program, and I serve as the co-director of Health Confianza.
Thank you very much, and thank you for presenting the didactics today. I also have Dr. Rosenfeld.
Hi, good afternoon, everyone. I'm Jason Rosenfeld. I'm an associate professor in the Department of Medicine at UT San Antonio, co-director of Health Confianza with Dr. Stone. And if I don't get a chance to say it now, I want to wish everyone a happy Thanksgiving next week.
Thank you. Second that for everyone. Now we have Corinne. Ms. Reyes.
Hi, everybody. Corinne Reyes, Chief Programming Officer, YWCA San Antonio. We are a former organizational health literacy graduate organization, and we are currently operating through the Health Confianza program in a variety of different capacities. So happy to be here with you all.
Thank you. Thank you very much. And you're going to be also our lead specialist. And we have Ariel Gomez.
Hi, good afternoon, everyone. I'm sorry I'm not on camera, but my name is Ariel Gomez. I'm the Center Director for South Central Area Health Education Center, also known as AHEC. Just like Corinne, our center is working with Health Confianza in very different aspects, including being a community partner, and we're also in the pledge program as well.
Thank you very much. And case presenter, Annette Cuba.
Hi, yes, hi, I'm Annette Juba. I work at the Breast Cancer Resource Center in Austin, Texas.
Thank you very much for presenting this today. Just as a quick reminder, toward the end of the session, our team will send you a link for the CMEs and evaluation of this session. And these sessions are possible because of you. So your feedback is so important. So just finally, I would like to mention the ECHO is all teach on learn environment. So we encourage to share your experience, your questions, your insights in our conversation today. With no more from my end, let me go ahead and give this space to Dr. Stone for the didactics.
Great. And before I begin, I just want to thank you, those of you who have been on this journey with us this fall through the different ECHO presentations. I see a lot of familiar faces who have joined us every session or nearly every session. It's great to have you, and also welcome to those of you who are new. We love that you are joining us, and just wanted to let you know that we will continue this health literacy ECHO in the spring. We're going to have a new series of 6 additional sessions that will be advertised to you soon. And so I hope you will continue on this journey with us. And before I start sharing my slides, I just wanted to get some feedback from you all. So I have been working in the health literacy field since about 2007. So it's been a long time. And one of my favorite things to teach people is teach back. I want to see if you can just use the React button at the bottom of your page there and raise your hand. How many of you have heard the term teach back? You can raise your hand if you've heard it. All right, I am seeing just a few. Okay. So this sounds like it might be a helpful topic for you all. So let me get started here with sharing, and we'll see how this goes. How's that looking? Someone can unmute and
Very good, very good.
it's good.
Very good.
Thank you so much. All right, so today we're talking about bridging the gap with Teach Back. And before I begin getting into the specifics of that, I like to set the context. And so I'm going to read to you a documented scenario. There's a lot of health literacy scenarios out there. We've been talking about different ones through this series, but let me read this one to you. A 2-year-old is diagnosed with an inner ear infection and prescribed an antibiotic. Her mother understands that her daughter should take the prescribed medication twice a day. After carefully studying the label on the bottle and deciding that it doesn't tell how to take the medicine, she goes ahead and fills a teaspoon and pours the antibiotic into her daughter's painful ear. So as you can imagine, that is not going to be a good outcome for her daughter. It's going to make her condition worse. And how familiar does this scenario seem to people? If you don't mind just unmuting, because I can't see you, just unmute and let me know. Is this something that resonates with you all?
Yes.
Yes.
Okay. Yeah, the reason I think that it does is because it's very realistic in that this mother has some amount of knowledge about what to do, right? She knows that she needs to give her daughter medication for her ear. She knows that it's an antibiotic to treat her daughter's infection, but she doesn't understand the full set of directions 100%. And that could have been a failure by her healthcare provider, by the pharmacist, but somewhere along the way, there was a gap that didn't explain and just, the instructions assumed she knew what to do. Well, we can't assume that. And so it makes sense, right? If you have an ear infection, you want to, treat the ear. And so that's really a bulk of what of our health literacy errors can be is understanding some of the information, but not all of it. And if you don't understand it 100%, that lends itself to issues, and those issues might be small and minor, or they could be very large and potentially deadly. So it's very, very important that when you're explaining something to somebody that you make sure that they fully understand it. And that's what Teach Back is about. So what we're going to talk about today is what it is. And sometimes it's easier to begin by saying what it isn't. So we'll start with that. We'll talk about why it's important, and hopefully you'll agree by the end of the session that it is. And then we'll actually spend some time, and this is a part that a lot of people don't do, but we're going to spend time actually breaking it down step by step so that you feel very confident in using TeachBack. It's a pretty basic, straightforward concept, but it does require some skill to it. So we're going to go over that with you. So why you may be wondering, why focus so much on TeachBack? There's a lot of health literacy skills out there, and to be honest, if I was only allowed to ever teach one health literacy skill to people, it would be TeachBack. And I'm not alone in this. There was a consensus study that actually assessed about 32 different health literacy practices. And those could be things like avoiding jargon, medical jargon, using effective questioning techniques, making sure you're using interpreters, using appropriate visual aids, making your instructions interactive, all these different practices that you could do. But a consensus study of 25 experts from different fields from around the country all identified as TeachBack as the #1 competency to teach future healthcare professionals. So this drawing underlies, it's very simple, right? The doctor is talking to the patient, and at the end of the visit, she asked, do you understand? She needs to make sure on her chart that she has documented that the patient understands, right? So do you understand? The patient doesn't necessarily understand everything, but she says yes. And this is a huge problem in our healthcare system. So the provider is pressed for time. She wants the patient to say yes so that she can go on and see her next patient. But the patient, on the other hand, I mean, just look at her. She's in a gown, barely clothed. She may be feeling sick at the time of this visit. She's feeling very vulnerable, and she's probably feeling either embarrassed or not empowered to tell the provider that she doesn't really understand either part of it or all of it. So that's what TeachBack is not. What you don't want to do is ask the question, do you understand? We're going to come up with a better question in a minute here. So what TeachBack is asking your patient or client to repeat in their own words what they need to know or do. So it's really straightforward, but it's the beauty of it is that it allows you right then and there in that moment to discover any gaps that there might be in information, and maybe misunderstanding, maybe it's a different context. And it allows you to immediately clarify that. So before they leave your office, before they go home, they will have that clarified. And so this is a much better scenario where they find that they're on the same page. And then just an interesting anecdote to that is that a lot of times when patients are in a doctor's office, they are getting a lot of information. Well, guess how much of that information they actually retain from that visit? What do you think they actually remember from what that doctor tells them or that healthcare provider tells them? What % of that do you think?
30%?
So you're close. Any other guesses?
There is 20% in the chat. There is 10%, 10%.
Some of you are less optimistic. So it is right in there. So most patients forget up to 80% of what their doctor tells them. This was documented in a study a few years ago. And then what's even worse then is out of that 20%, nearly 50% of that is recalled incorrectly. So that means it wasn't recalled 100% or there were inaccuracies in it. So they're only remembering 20%, and then out of that 20%, only half of that is completely accurate. So that's a really shocking and reason that we need to make sure what we can do to make sure they understand as much as possible. And then we've talked about this before in our series, but people's health literacy in any given moment is situational. You don't always necessarily have high health literacy, even if in general you usually do. You might be in that doctor's office and you might just, have gotten a very shocking diagnosis that you weren't expecting. Maybe the doctor's telling you now have diabetes and you weren't expecting that. So now your ability to comprehend information is even less than it might normally be. So TeachBack is not a test of how, and this is a really important concept that we teach our students. It's not a test of how well that patient understood you. We're not testing the patient. We're not testing that client. But it's how clearly you explain the information. It's a test on you. How well did you deliver that information? So that's one aspect. Another key aspect is that it allows that person to process and repeat information. I'm sure you have learned in your own, the way that you learn information. If you can you might think you know it in your head, but then you go and you tell your spouse or your family member about what it is you're trying to say, and all of a sudden you're like, oh, maybe I don't really understand it as well. I can't explain it. So if that patient can actually say it, then it definitely stays in their mind much clearer. So another reason that we spend a lot of time on TeachBack as a practice is that it is the most evidence-based skill in health literacy in terms of all those different practices. There's a lot of research. I've pulled up, a few different types of studies here to just show you how it is an evidence-based practice. And let me just go back. And one of the, of course, one of the most important things is that you actually are coming out with better patient outcomes in terms of disease conditions like glycemic control. It has been documented, but you're also coming out with better knowledge. You're coming out with better confidence and self-efficacy to be able to take care of yourself and your health condition. And also from a practice perspective, there are fewer surgeries and cancellations, or fewer surgeries delayed or cancellations in your practice. So it actually benefits the practice as well to use this. It is also recommended by different accreditations, different organizational practices that do recognize the benefit of TeachBack. One of the most important being the Joint Commission, which accredits our hospitals. So now that we've kind of laid out the context of TeachBack, I want to actually take it step by step for you. So this 5 T's for TeachBack breaks it down into 5 steps. One of my health literacy friends and colleagues came up with this and published this several years ago now, but it's a really useful way to teach it. It's useful when you're learning it and you're starting to adopt it in your daily life. It doesn't mean that you always have to think back later to what was step 1 or what was step 2. It's just going to become natural to you. TeachBack was actually developed back in the 1970s as a skill for education, and it was used in some other professions before it came to the health field. It's actually a wonderful communication practice to use in your personal life. It doesn't have to just be used in your professional setting. It really will make your communication with everyone so much better. So step number 1 is triage. And that's where you are going to focus on just one topic for TeachBack. So when you are having an educational setting, one-on-one with somebody, or they're in your practice, you have lots of things that you need to tell them about. You can't do TeachBack on everything. It's just not possible. So you have to pick the most important thing that you want that patient to be able to do once they get home. And so how do you decide what you're going to do teach back on? You can start by asking your patient some questions about what they already know about the topic. That'll let you know maybe what their remaining gaps are. And so, having that conversation, getting to know your patient or client will help you know what they need teach back on. You can also base it on the experience that you have with your other patients and clients. There starts to be certain patterns of what people are needing help on. So triage is the most important, or is the first step. Next is to use tools. So as adult learners, we are learning in a variety of different ways. Some of us like to learn things visually. Some like to have, something hands-on to manipulate. Some do it, by hearing. But the truth is, all of us benefit from using a variety of ways to get that information. So if you're talking to someone and you can use a model a 3D model to show them, even a poster, if you have something that you want them to do, like using an asthma inhaler, have them actually demonstrate using the actual tool, the asthma inhaler, maybe a pill organizer if you want to see how they're sorting their pills. So you want them to look at or manipulate something as a tool. One of my specialty doctors, I just love it because he will write things down for me, and it's very simple, but he writes it down as we're talking, and then I take that home with me, and it's a reminder to me of what we talked about. And so it could be just as simple as that. The third step is to take responsibility for the communication. This is very, very important, and you'll see that this is the step that is often missed in teach back, which is not a good thing because what it does, if you don't do this step, if you don't set up your teach back, then it may feel to the patient like you are trying to test them or it's about them. So you always want to take responsibility by saying something like, I want to make sure I did a good job explaining before you ask them to do the next step, which is the tell me. This is where you ask them to tell you in their own words what they are going to do or what they understand. You might have them show you. So instead of telling you, you might have them demonstrate for you. And it's really important to be explicit and specific about what you want them to tell you back, because otherwise it might get out of hand if you're like, just tell me everything we talked about. So you need to be very, very specific about what it is. And then finally, if you go through these steps and the patient doesn't tell you back correctly or doesn't tell you fully everything, that's when you might need to try again. So you want to make sure that teach back step is happening to your satisfaction, that you feel like they really know and understand. And if they don't, you really need to try again. And so if you try again, you probably don't want to teach it in the same way. You want to now change things up. Maybe you need to think about using some plain language. Maybe you need to show a different tool. Maybe you need to make an analogy for them that resonates better with them, but you need to change something up. Then you go through these steps again, and hopefully now they're able to do it correctly. And if not, you're going to have to try again. So that's what teach back is. These slides are just pointing out some things that we've already talked about, just as a reminder. For triage is making sure that you focus on that one topic and making sure that you think about what they already know as you're talking to them. And then again, taking responsibility, as I said, is one of the more challenging steps. But I think if you make that part of your lead-in, it'll make the whole thing go better. And so if I was to say, can you tell me what I just said? That's like, oh, that's a lot of pressure. So the patient may say or think to themselves, well, I don't really remember everything. This feels like a test. The doctor's going to think I'm an idiot. I don't know where to begin. And on top of it all, I'm sick. Why are they asking me this? Why are they doing this to me? And so you don't want to do that. Instead, you want to have a lead in like this, which is, wow, that was a lot of information I just gave you. I want to make sure I did a good job of explaining because this topic can be confusing, like it can be confusing to people from my experience. So, can you tell me in your own words how you're going to take your medication? Or you might say, when you go home tonight, how are you going to tell, or what are you going to tell your husband about what we talked about today? Just something to get them to be able to tell you. So we are going to practice this. So we've talked about those 5 steps, and we're going to put it together into a scenario that we are going to discuss as a group. So let me paint this scenario for you. So imagine you are a woman who had unprotected sex the night before. The next day you go to take your pill, your birth control pill, and you see that you've missed 2 of your birth control pills in a row. And now you're starting to panic a little bit because you had unprotected sex and you're like, what do I do now? So you're going to go to your birth control packet instructions to try to figure out what to do. And those instructions say, if you miss 2 light pink active oral contraceptive pills, OCPs, in week 3 or week 4 of your packet, and if you are a day 1 starter, take the 2 OCPs you missed today and 2 OCPs tomorrow at the regular time. Right. That is not the clearest instructions. And on top of it, you're already in a mindset of feeling a little bit frantic. And so this is a scenario where you might want to have someone do teach back with you. And so what a real health educator told us about how they would handle this exact situation is recorded here. So the health educator, and as I read this to you, think about those 5 steps of teach back, the triage, the tools, the tell me, the take responsibility, the tell me, and the try again, and see if they are using all of those different steps and what they say. So the health educator says, I ask the client, okay, tell me, if you miss a pill, what should you do? If she doesn't know how to explain it to me, right there, I already know, okay, she's not really grasping this information. So I go over it with her again. This is what you do if you miss 1 pill. This is what you do if you miss it for 2 days. I give her an example. I say, let's say you left town for the weekend and left your pills at home. So you missed 2 pills. What are you going to do now? And then I also give her the pill packet. If she can't show me what to do, I really don't feel comfortable because they're bound to miss their pill. It's going to happen. So it's just like, okay, you've got to really break it down for them. So if you could just unmute anybody and tell me, do you see the triage step here? Does the health educator know what to do the topic on? And if you're writing in chat, let me see if I can see that.
I can help you with the chat, but I haven't seen anything yet, Dr. Stone.
Okay.
I'll help you with the chat if something.
So let me get you started. So your triage decision would be what to do if you miss a pill, right? That's your single topic that you want to do teach back on. And the health educator knows, right? This is an important topic because she says it's going to happen. They're bound to miss their pill. She has experience with her clients doing that. What about a tool? Does she use a tool?
It says the packet. Yes, she gave them a pill packet.
Yep, that is definitely a tool that they can use to show you.
Mm-hmm.
Any other tools that you can think and think creatively about what a tool might be here? Any other tools?
Calendar, reminder, example of missing a pill during the weekend.
Yes. So the calendar reminder would be great. She doesn't talk about that, but those would be great tools. But yeah, she does use that example, and examples are a sort of tool as well, right? Because they put that concept into something that's a real scenario for you. And so, yes, that is another type of tool.
Two more is phone calendar and alarm reminders.
Yeah, so those would be great tools that you could use for sure. And then what about the step of take responsibility? Does she take responsibility? Does she do a lead in to her teach back? And on this one, I usually expect silence because it is missing. So unfortunately, remember what I said earlier, the take responsibility, having that lead in is often something that we aren't seeing. So we want to make sure to do that. So that's this health educator would benefit by adding that to her step of the tell me. And so does she have the tell me or show me step in here? She does, right? So she implies that she has them show her the packet, and she also has them say, "What are you going to do?" So those are the tell me and the show me. And then what about try again? Do you see try again? That's right up here in the very beginning. I go over it with her again, right? So if she doesn't know what to do, then they are definitely going to try again. So this highlights those 4 steps because again, the taking responsibility was not mentioned here. Okay, so I'm going to spend. Do we still, Raquel, have a few more minutes, or do I need to skip?
Yeah, you can. Yeah.
So these are 2 short videos. They're like 2 to 3 minutes each. And I like to show videos of Teach Back because it really brings it to life and makes it, when you can see someone doing it, it makes it so much better. So this first example is of a hospital discharge situation. And I will tell you from the beginning that it is an over-the-top scenario, but it's useful to see it and analyze it because we're going to watch this one, and then we're going to watch one that hopefully is a better example of how to do Teach Back.
Let's make this quick. Okay, hey, Ms. Merriweather, good to meet you. I'm sorry I have to go quickly here, but your MRI was negative, so we're going to be able to discharge you today, okay?
Oh, I wasn't ready to hear that. I thought I'd be here a couple of days.
More
tests.
Well, things change, so, there's no need to worry. I mean, everything checked out okay. Your MRI was negative for the stroke, so, you still got your other medical problems. I mean, your CHF, your diabetes, your COPD, your hyperlipidemia, your hypertension. There'll just be a few changes to your medications that we'll provide to you on your, on your discharge paperwork. And I got all your prescriptions right here.
Dr. Shockey, who will be following up with Mrs. Merriweather.
And a regular doctor, of course.
I haven't seen a doctor in years.
Oh, and then get the social worker on this. Take care of this promptly. This is a non-medical issue. It's not going to delay our discharge. Now, here, Ms. Merriweather, these are all your medicines and your discharge instructions. Just follow with your PCP, in 1 to 2 weeks. Should be okay.
So remind me how to use my insulin.
Let me go through the medicines with you in a minute, ma'am.
Do I need an IV?
What, for your insulin?
Yes.
No, we'll take care of that. Any other questions?
Do I give it to myself?
Yeah. Any other questions about your medicines?
My Nexium, should I take it? Do I get it?
Okay, we are going to stop that because I think you get the idea of what's going on there. So I said it was over the top. Unfortunately, it may not be that out of the realm of possibilities in some cases. So I want to hear from you all. Have you seen hospital discharge situations like this or heard about them?
Yes.
Okay.
Yeah. Yes. Mm-hmm.
So unfortunately, right? I'm hearing some yeses. And what did you like or not like about how this interaction was taking place? I mean, the doctor obviously I'm seeing here was moving fast, right? They do have strict deadlines. They're trying to get patients out of the ER as fast as they can. So he definitely was rushed. What else? Not listening, very dismissive. So what was his body language like? Kind of hovering over her, and then he kept asking, what was really important here? What was that question he kept asking her about her knowledge of her medications?
Well, it's a comment here. It says he is in a hurry, no time to hear the patient.
Yeah, and what was that question he would ask her? Because that's key here. Remember what I said in the beginning about what question do you not want to ask?
Anything else about your medication?
Oh, there it goes. No, but somebody answered. Do you understand?
Do you understand? I know it sounds like it's a good question, right? But in this scenario, it's not. He had to he had to keep saying, "Do you understand?" Right? Because he needed to check that off before he could leave. Now, what was probably the most unrealistic is this woman did keep asking questions. I mean, as you can imagine, most patients in that situation would have shut down and not even felt empowered to ask the questions. But she did for the purpose of this scenario here. And he was very dismissive. He didn't explain. He kept passing it on to somebody else. So, well, the social worker or the nurse will explain it to you when he had an opportunity right there to teach her something and do teach back with. And yes, it was a very complex case, but he definitely did not use teach back. And this, what are the chances that this woman's going to go home with incorrect or incomplete understanding of what she needs to do? So with that, let's go to the next video.
Let's make this quick.
So I want you to look at this one. I want you to see if you think it's better than that one, and if there's anything in here that resonates more with teach back. So we'll just watch a little bit of this one.
Hi, Mr. President. I don't know if you remember me.
Sure,
we talked the other day about heart failure and some of the things that you can do to keep yourself out of the hospital.
Sure.
My name is Peggy. I'm a nurse practitioner, and I know we had a little conversation the other day about things to do when you go home and what the heart failure means and all that. And one of the things we talked about was weighing yourself every day. Do you recall that conversation?
Sure, yes.
Okay, and what do you remember about that?
That it was pretty important that I weigh myself at the same time every day. And whenever there's a weight fluctuation of 2 pounds in a 24-hour period or 5 pounds in a week period, then I should notify my physician or a nurse practitioner of the weight change.
Okay, and what do you think they would do about that then?
They'd adjust my medicine, my water pill, to help take care of the added water.
Okay, and what does that mean when you carry on water? What does that mean for your heart?
It slows, it puts pressure on everything. My legs swell bad, and I'm not very comfortable.
So those are all the symptoms that you would look for to see if you were weight gain. And weighing yourself every day is your early warning system. That's going to tell you, that the fluid's coming on before those symptoms show up. I know you mentioned the other day that you did not have a scale at home and that you didn't think you'd be able to purchase one. So I brought one for you, and so this is for you, and this weighs about 5 pounds. So just so you know what 5 pounds feels like when you start putting 5 pounds on.
Thank you.
Yeah, so you can see that might make a difference in how you feel with that. So that's for you to take home. And then do you have some place at home that you would write the weights down? Do you have a calendar?
Sure, I can write it on a calendar.
Okay, so it's a good idea to write it down, and then you can kind of see within a week period of time if there's 5 pounds up.
Okay.
And so you can kind of keep that in your thought process. So when you go home, what are you going to tell your significant other, your spouse, about what you're going to do different now?
I'm going to weigh every morning at approximately the same time. before my breakfast and after I get out of bed and use the restroom. So as you explained to me, that way my body weight will be pretty close to what it's going to be should be most of the time.
Okay. And in that way, if we can keep your weight within the same way, about the same place, that will keep you out of the hospital, and hopefully you'll be able to stay home and not have to come back and forth to the hospital like you've been doing. So that's our goal, and it sounds like it's your goal as well.
Okay, so in that one, do you feel like the teach back was happening in that one?
Yes, it says on the chat, yes.
Okay, and what did you like about this one compared to the one before?
So much more approachable. She did a great job. She asked questions, more interaction between both of them. She asked questions. She was attentive. She was sitting at eye level, good distance, space, more personal. Patient felt confident. She appeared to have heart. Yeah.
So that's a lot about her body language and her approach. So she would sit down, she wasn't hovering over him. They were, making eye contact. And then was she actually using the 5 steps of teach back? What was the thing she was wanting him to do teach back on?
Questions? Clarity, it says clarity and question.
So what was her goal? She wanted him to actually weigh himself every day, right? To keep an eye on what his weight was doing. So yeah, Daisy, thank you. And then what about, did she use any tools? Did you see her use any tools in that conversation?
Yeah, I'd say that she not only acknowledged something from a prior conversation when he said that he didn't have a scale. So she brought him a scale, and then she said, I want you to feel the weight of it so that he can also kind of make that mind-body connection as to like what 5 pounds is.
Yes, beautiful. So that scale was a very useful tool. And she was giving it to him, and she also made it so he understood about the weight that he needed to keep an eye on. Did they talk about another tool? Do you remember? What's he going to write his weights on? A calendar, thank you.
Calendar.
Yep, so that would be another tool that was used. Did she have a lead-in? Do you all remember? How did she ask him to do the teach back? What did she say as a lead-in?
Well, you want to say to the significant other when you come back.
Yeah, very good. So what are you going to tell your spouse when you go home? So that's, the way to make it, we talked a lot about, a lot of stuff today. What are you going to tell your spouse? And so that she made it, instead of making it feel like a test, it was more like this made it have a connection. And he did the teach back correctly when he did it. And so she didn't have to have him repeat it. So all in all, I think hopefully that was a much better way to do teach back. And I'm going to end here now with just one of the concerns that people have. I think you should be aware is that they worry about time, the time that it takes to do teach back. And there are studies that have looked at it. And yes, it does take a couple of minutes, adds a couple of minutes to your session, but the return on investment is that you then have the person not having misinformation, making sure they're, taking care of themselves. It actually keeps people from having to come back, be readmitted to the hospital or come back to their provider. And so in the long run, when you look at it holistically, it actually is saving, it's a good investment, saving, preventing adverse outcomes, and could be, saving time when you think about it in that broader context. This is a summary slide of the what, why, and how of teach back that you can always refer to in the future. And then these are my acknowledgments and references if you want to dig a little deeper into some of those. And so sorry if I went over time, Raquel, but I want to stop there.
No, thank you very much, Dr. Stone. I think this is very, very important and very informative didactics and presentation. Thank you for, you say, like the most evidence-based practice and takes just 2.6 minutes longer, and that helps a lot during the encounter. And please continue with the chat. I think we did very good in the chat. Please keep adding your questions, and I would like to see if we can just move to our case presentation for today. Miss Annette.
Hi there. Yes.
Oh,
so
yes.
I think that this case presentation is going to be a lot like that first discharge scenario. The situation is an 85-year-old woman who had been transported to the ER via ambulance after feeling faint and weak at a restaurant. She had a reddened area on her arm. There was some confusion or some disagreement whether that was a skin-related thing or whether it was an infection-related thing. Her family was with her throughout the day. There were numerous tests run, no abnormal findings. The doctor decided that it was a skin condition, the reddened area. He was going to order some cream. She was discharged to home. And really the discharge orders were presented to her as, you're going to need to take some cream. It's all written down here on the papers. Here you go. I think this was a personal situation. I was one of the family members that was there. And from what it looked like or felt like to me, on their end, the hospital personnel sort of didn't want to insult the woman because of by going into excess detail about the changes because it was so minor. And on our end, as the family members, we all wanted to appear to be professional and competent. And yes, of course, we understood what was going on. It turns out when we got home, there were some questions that were asked of exactly what am I supposed to take and when and where do I get it and why do I need to follow up with my doctor? And I think that on my end, I wish we had, as family members, had asked for more details, even though it seemed like a very minor change. I think on the hospital personnel end, it was a sense of not wanting to appear condescending to the patient of, here's this minor thing, but I'm going to go into sort of excruciating detail about what it is you need to do. So I think it's a case where teach back could have been super helpful. I do think the staff were super polite, super attentive throughout the interaction. It appeared to me that all of the discharge paperwork was sort of CYA. We're going to give you all these thousands of pages of information so that we can say that you've had it. I also, my second point on this slide, I wonder if this is an area where class issues, racial issues, some of those other sorts of factors came into account of, you look like somebody who should understand this, so I don't need to go into detail with you about it. I don't know. I think the question for me is how do you do these good teach back practices and have it not come across as sort of condescending? And how do you, I appreciated the point in the teach back about, you're wanting people, you present teach back as, I want to check and make sure I gave good information. I could see myself as a patient in that, wanting to assure the staff member that yes, they did do things well, and agreeing that yes, it was great teach back. So I'm still interested in learning some of the nuances of how to give good detailed information and not appear condescending and not not try to enlist the patient in making me feel good about how I communicated.
Thank you very much, Mitchell, for presenting this case. And in this moment, I would like to open up just this space for everyone, question, and to open up for the discussion of this case. But Dr. Stone, how we can, like it was the question, how we can use that teach back, very, very, and you didactics for today when you have a lot of paperwork and a lot of instructions.
Yeah, no, Annette, I think that is something that we do hear a lot from people. Like, I don't want to seem condescending, that's when I'm training our healthcare providers. And it absolutely won't come across that way if you use, that correct lead into it. And so that's why it's a skill. It's something that as you practice and get more comfortable with, it really just becomes part of the practice. Like, this is what we do. This is something that is challenging for some people. I want to make sure I did a good job. And so when you say it like that, it shouldn't come off as condescending. I did want to mention, because I think another useful thing for all of us to know is there is something called reverse teach back. And, since I'm so immersed in teach back, when I go to my healthcare professionals, I'm always looking to see if they're using teachback. And unfortunately, very few do. And also when my mother was suffering from chronic conditions, they weren't using it with her either. And she had some very complex health conditions. So what you can do as a patient, and this is something you can teach your patients, is do reverse teachback. And so if my provider is not doing it, then I'd initiate it by saying, well, I want to make sure I understand what we talked about today. Is it okay if I tell you what I understand? And then you say what you understand, and then that gives them the opportunity to do the same thing and correct any misinformation or any gaps. And so reverse teachback is really just a way for you to initiate it if your provider isn't doing it.
Thank you very much, Dr. Stone. Is there another comment?
I can see as a family member that it would have been good to step in and take on that role of, I want to make sure I understand.
I don't think you're probably not the only family member who's ever been put in that position ever. That is a skill. And, as we all need to also teach the families and the clients we serve to have that skill, to be able to advocate for yourself and be okay with saying, can I tell you what I understood? Another way that in nursing we do teach back is we call it the see one, do one, teach one. So that's another way you can kind of teach things to people and like really solidify things. You show them and then you have them do one and then you have them teach you, right? To kind of like just really seal the deal on that. So I just wanted to offer that as another methodology for doing teach back as well.
And that I think having family members or a friend or someone with you in that visit is crucial, especially from what I hear of my nursing field friends in the hospital setting. It's so important to have someone there with you to advocate for you and to keep an eye on things. And so that's another health literacy practice, is just involving the patient's friends and families in the information.
Yeah, and because there is so much information that is going to be receiving during that moment, that having a family member is always is going to be a very good recommendation. Amanda, do you have a comment?
Yes, thank you. And I can't access the chat or any reaction, so thank you for acknowledging me. I think for me also, when addressing or trying to disarm the individual who may be offended, I say, like, you may already know this, but I'm going to tell you anyway. And then, just kind of play around with them, just so that they can receive the information. Because, yeah, if you do feel like it is a situation where that person may feel that there is, they could potentially become offended, or if they're perceiving a slight, then you can kind of break the ice with that. Like, you probably already know this, but I'm just going to let you know. I'm just going to say it anyway. And then you can initiate the teach back opportunity through that experience or that method.
I like that.
Yeah, very, very, very kind. Mm-hmm.
And I'll
Dr.
just, yeah,
Rosenfeld.
I'll just add one other thing, Amanda, because I agree with you 100%. Like, as we were having this conversation, I was thinking it requires some humility on the case of the provider, whoever that provider is, right? Just understanding that not everyone, when you come with that humility, it usually can disarm that piece. And then, oh God, what was my point? There was something else I was going to say. Oh, I shouldn't have gone with such a large preamble. It'll come to me in a second.
Or
But
something, yeah, something about how you want to have the conversation, perhaps with humility and kindness, I guess.
Oh, that's what it was going to be. So, like, as part of the humility is even laying it out to say, this is a common question that people will ask, like normalizing it so that it's not as dismissive because you're like, hey, I've had these questions before, so I'm going to go ahead and potentially preempt some of the things that may already come up. And again, to Amanda's point, you may know it, but I always get these kind of questions.
Exactly.
And, I think it is so important to do that because I think, Annette, what you were saying earlier is that in your case, there may have been some, perceived assumptions by the healthcare team about what you and your family knew. I can tell you from personal experience, I was misdiagnosed with a serious health condition for about 6 months. Took 5 doctors with me finally offering the diagnosis of what I thought I had by the 5th doctor after suffering for 6 months and going through all sorts of tests and procedures. And when I think, reflect back on it, I think a lot of it was they assumed that they had made assumptions about me. And so they weren't doing all the steps that they maybe would otherwise have done. And so again, it's just so important for as healthcare teams to have use universal precautions and just assume that everybody needs this. So
Thank you. Thank you for sharing that. Also very personal and you all that have been sharing all these comments. Very important because that's what bring all together. And there is another comment in the chat, universal precautions, what is it's a great term. Thank you very much. And thank you for all your comments, questions, and suggestions, and all these that have been in the chat as well in live and in the video. I would like to move with the summary of recommendations. Ms. Corinne Reyes, if you please give us the summary of the recommendations.
Sure. So Dr. Stone did a wonderful job today with this presentation. What she went over with us today was what teachback is not, and that's a bunch of closed-ended questions, so we all know that that's not what we're going to do. And this is a way for us to discover gaps in understanding our patients' health concerns in their own words. So we're doing this is what I meant, and then this is what I heard. So it's a two-way dialogue between you and the person you're serving. So when you say it, you know it. And that was one of the most important phrases I think I learned today, because I think that is so correct. When you can say what you heard, then you really do understand what was being taught. The next most important part was the 5 T's. So if we take anything else away from this, it's those 5 T's, which is triage, focus on that one important topic, the tools, the models, the posters, the pill packs, whatever you have on hand. Take responsibility. Did I explain it well to you? So that the onus is on you to make sure you're explaining well. Tell me or show me. And then try again if you need to, and just repeat all those steps again. So thank you, Dr. Stone. That was a wonderful presentation.
Thank you, Ms. Corinne Reyes, for the summary of these recommendations. Ms. Annette, I hope all your questions were answered. And thank you so much for all that participating in our session today. Thank you very much, Dr. Stone. That was a wonderful presentation. And to you all, thank you so much for being in our session today. Before giving the last comments, I just would like to read what is in the chat. I agree with that. Sometimes we make assumptions about a person level of understanding. Love the presentation. Thank you, amazing presentation. Thank you so much for all that participating in our session today. And that was excellent discussion. To learn more about the continuing education credits, please click on the link that it was shared with you in the chat. This is going to be open until Wednesday, the 26th at 12. p.m. And we're looking forward to see you in our next series. It's gonna start in February. Please be aware of that you're gonna receive some emails with the following series. It's gonna be, I was told that it's gonna be on Fridays at the same time and every other week. So thank you so much for being in our sessions today and have a wonderful holidays. And I hope to see you next year. Thank you very much.
You all hope to see you in the spring. Thanks.